Welcome to Soar Point Massage and Manual Therapy. The purpose of this video is to discuss muscle energy technique and its treatment in helping patients who have soft tissue pain and dysfunction. Muscle energy technique was developed by Dr. Fred Mitchell, and it's both an active and passive, very gentle way of dealing with joint hypermobility. Basically, when you evaluate a patient, you want to look for dysfunctions in the body from a postural standpoint, from a range of motion standpoint, doing any special tests that you need to do to determine where the dysfunction and problem is coming from. So a lot of times what we're going to do is we're looking for where the joints are stiff and what role the muscles are playing in that. Okay? Muscle energy technique is a very gentle, easy manual therapy technique to do for both the patient and the therapist. As we do a postural evaluation, we may find that a patient like Norm here may have an anteriorly rotated hip. And a lot of times patients say they have a long leg because that pelvis rotates forward, or the ilium rotates forward on one side. Well, if that ilium rotates forward and is jammed, then we have joint hypermobility. So what we do is we check range of motion and see where the body likes to go and where it doesn't like to go. So we're going to take him through a range of motion and see, does he like to go into flexion or does he like to go into extension? So we drop the leg off the table. And we're looking for where the joint has hypermobility or where it's stiff or where it's tight. Okay? So what we're going to do is, with your right hand, we're going to palpate the joint, and as we take him through a range of motion, we're looking for where is it stuck, where is it tight. And then we use a gentle, active, assisted compression. So Norm, I want you to gently press your knee into my shoulder and hold. Typically hold for about 3 to 5 seconds, and then release. And then we take him back out of that. And we look for the next barrier. Okay, now you can go a little bit further, and we take them just out of the barrier. We don't go into the pain. We just go to the edge of where the restriction is. Gently press your knee into my shoulder. Hold. Breathe in. And breathe out. So typically a 3 to 5 second hold, and release. And we take them back out, and we look for the next range of motion. Now we can go further. Now there's the next barrier. We back off a little bit. Gently press. So we never do any high velocity. We never use any ballistic techniques. Very gentle and easy, working with the body's physiology. Slowly relax. Not trying to overpower it. So with muscle energy technique, we're working with the body's physiology. Gently press. Hold, breathe in. And breathe out. And slowly relax. So muscle energy technique is both an active and a passive, because the patient is passive until we have him press. I actively move the body into a range of motion, and then we recheck afterwards, and we have better range of motion. So that joint hypermobility can cause pain just as well as the soft tissue dysfunctions can. So we check to make sure that the hips are level, the joints are moving better, and your range of motion is improved. Excellent. So if you'd like to find out more information about muscle energy technique and the differences between the types of manual therapy, please sign up for our free newsletter or read our blogs. Thank you.